Medical school in the 18th century was very different in certain aspects than what we do today. There were no clinical studies. You never touched a patient when you were in medical school. It was mostly reading the classics of surgery and medicine, Hippocrates, Galen. You may, if you were at a very, very advanced medical school, may get an anatomy lesson once or twice, but primarily it was just reading the writings of the old philosophers. Then, to graduate, you had to present and defend your thesis in Latin to a board of doctors. Once that was done, they would give you your certificate and you could call yourself a medical doctor. Now, the first patient that you saw was the very first patient you ever laid hands on. So they didn't have a lot of practical experience. Now, another method of getting medical education, and this was done much more often because medical school was expensive. They only had 2 medical schools in the 13 colonies into the United States. That was King's College in New York, which is now Columbia University, and the Teaching Hospital of Philadelphia, which is University of Pennsylvania. The universities in Europe were much more well thought of. That was like an Ivy League school versus a community college, so to speak. Now, the other method of getting medical education was not quite so formal. It was an apprenticeship. And like everything else that they did in those days, you went and lived with a person for a certain period of time, and as long as you followed his teachings, you could practice medicine. And up until about 1920, that had the same professional cachet as a medical school degree. A doctor had to be prepared for anything. It could be something as simple as a common cold. It could be something as complicated as amoebic dysentery, any type of injuries, fractured bones, frostbite, infection, burns, cuts, just a little bit of everything. And doctors had to be prepared to be able to deal with that with their supplies that they had to hand, because it wasn't a matter of you just write a prescription for the guy and send it in the local drugstore. You had to be able to manufacture the medicines and treat the wounds as they came up. If we look at it through 21st century eyes, infection was a foreign concept. They had no idea what infection was. They saw the wounds would inflame, they would get swollen, they get red, they get full of pus. But they considered that a part of the healing process because all these wounds were done. Now, they would do some things that were good for wounds. They would use various concoctions containing turpentine or honey or such like that that were helpful in killing bacteria and killing germs in wounds, but they did not know it was. They were not able to identify what a germ or bacteria was until much later when microscopes came in and the science knowledge was caught up with the illnesses. If you were near a swamp or a river and the men started having fevers, they would consider a cause of that is the miasma, the bad air. As a matter of fact, the term malaria comes from bad air from Latin. So they would try to get the men away from it, but once they come down with it, that was basically supportive treatment. The only thing that they could come close to doing to treat contagious disease was to build a firebreak by giving you an inoculation, which smallpox was the only disease that they could do that for, and smallpox was a big killer. What they would do is take the pus from a person suffering from smallpox after he's on the mend, out of the wounds on his body, and insert that in the skin of a person that they wish to inoculate. And they would make sure he was healthy, and the person they were getting the pus from was on the mend. So the virus is not that virulent, and the person would catch it, and he would be immune from that point on. It was very effective. On average, the research we've done, smallpox, if you caught it naturally, it's 100% contagious. I mean, if a person in the camp, if you've seen the camp laid out, if one person had smallpox, the entire camp would get it. 1 out of every 4 patients would die from smallpox if they caught it naturally. Now, if you inoculated, 2 out of 100 would die. So you can see your chances were improved with that. And also, it conditions the Army to be, we don't have any nasty surprises. If the Army's going to attack a certain position, you don't want all your guys to come down with smallpox just before they do that. So that would make the leadership of the Army a little bit more confident in what they were planning. In the summertime, the primary illness is going to be intermittent fever, or what we know as malaria today. Caused by mosquitoes, high fever, chills, such like that. And that was endemic. Most of the 13 colonies had large pockets of malaria around.
Had nothing to do.
In the wintertime, amoebic dysentery or diarrhea. The quality of food was poor, the water was poor, and the closed-in situations caused a lot of loose bowels and such like that. There were a lot of ways that you could catch a disease in camp, because the tents that you'll see out here, these are 5-man tents. Not that 5 men got in them all at one time. They did what the modern Navy would call hot bunking. You'd have 2 or 3 asleep and 2 or 3 on duty. Now they swap off. They don't swap blankets. They don't swap straw. So whatever that guy's left behind in his tent, the next guy picks up. So it didn't take long for disease to spread. There were attempts at trying to keep the Army clean. His Excellency General Washington once put out an order to forbid the men from taking their ease on the company streets. Well, taking their ease means you was in the bathroom. And they would just defecate in the middle of the company streets because it seemed like a nice place to do it. And of course you're going to have that in the camp. And it was not healthy. Each regiment was supposed to have a surgeon and a couple of surgeons' mates, which were assistant surgeons. And when the English sent their armies over, each regiment was supposed to have that. Well, unfortunately, a lot of surgeons would say, well, I've got something to do and I'll catch up with you guys later. So there were actually British units that would go out and without any medical support whatsoever. That was the reason for the detached hospital. No matter what that doctor does, it's going to be better than the illness, and it's going to be better than the injury. No matter how filthy the surgical tools might be, no matter how unskilled the surgeon is, he's going to try to improve your chances for survival by taking that bad injury away. A bullet would be extracted by following the track of the bullet with your finger or another type of probe, and then tissue is cut away from it. If it had impacted a bone, usually they would not try to take that bullet out, they would just take the limb off. It was much simpler and much faster for the patient. Keep in mind that these doctors are going to be working as fast as they possibly can to ease the suffering of the patient and to keep the blood in the patient and to get him off the table as fast as he could because they may have another patient waiting.
Click the subscribe button below and the bell icon to get notifications for new videos about George Washington and behind the scenes work at Mount Vernon.